Hello and welcome to Ask the Experts, presented by Salinas Valley Memorial Healthcare System. I'm Claudia Otero. Today we're focusing on strokes, why and how they occur, risk factors, treatments, and the importance of calling 911 immediately. Our expert today is Dr. Rene Colorado. Dr. Colorado is a board-certified vascular neurologist and the medical director for the Stroke Center at Salinas Valley Memorial Healthcare System. Dr. Colorado, thank you for being here today. Welcome.
Thanks for having me, Claudia. It's a great pleasure to be here to talk about such an important topic.
Important indeed. Well, let me tell you a little bit more about Dr. Colorado. Dr. Colorado earned his medical degree as well as his doctorate of philosophy degree from the University of Texas Medical School at Houston and completed his neurology residency through Harvard Medical School at the Massachusetts General Hospital and Brigham Women's Hospital. Dr. Colorado also completed a fellowship in vascular neurology at the University of California, San Francisco Medical Center. He is a member of the American Academy of Neurology, the American Heart Association, and the American Stroke Association. Dr. Colorado, again, thank you for being here with us. Look forward to having this discussion with you today and talking about some very important topics regarding stroke. So let's begin with that question. What is a stroke and how does it occur?
So a stroke is it's basically an attack to the brain, and it occurs when the blood supply of the brain is interrupted. So when a blood supply to the brain is interrupted, the brain cells quickly die. The brain is a very sensitive organ, and lack of supply results in death of brain cells very suddenly. When the brain cells die, this results in major disability for patients. Stroke, as you mentioned, is a medical emergency, and something we'll talk more about later is the importance of time because, again, the brain is a very, very sensitive organ, and lack of blood supply can result ultimately in stroke and disability.
Okay, and what are the different types of stroke?
So we characterize stroke in two categories. One of them, it's ischemic, which constitutes here in the U.S. about 87%, and then the other one is hemorrhagic. So ischemic, it's the majority of them, and essentially occurs when there is a blockage of a blood vessel. So we can think of it as a water pipe. Basically, when the water pipe is blocked, there is no more water flowing. The same for a stroke, that it's ischemic. Now, for a hemorrhagic stroke, kind of the opposite occurs, where a blood vessel ruptures. So the pipe breaks, and there's spilling of the blood into the brain, and that also results in permanent injury to the brain cells. There is one subtype of the ischemic stroke, and that one is called TIA, or transient ischemic attack. Essentially, it's the same process where a blood vessel gets blocked, but that's only transient. So it reopens spontaneously. Typically, patients develop symptoms of stroke, but they resolve. We now treat TIA just as we do a stroke, because if someone has had a TIA, they have a very high likelihood of having a real stroke. So sometimes we call it a pre-stroke or a mini stroke, but patients don't have a permanent deficit from that, but are very high risk.
Okay, very good. And we will be discussing some of those treatments a little later in this program. What are the warning signs that you are about to have a stroke, or are there warning signs?
Yes, definitely there are. And I hope that, during the program today, that's one of the most important take-home messages. So one of the main characteristics of stroke symptoms is that they're sudden. So most of the time, the great majority of the time, the symptoms start quickly. And we'll talk about the specific ones that are more commonly seen, but in general, I try to remind patients any dysfunction of the nervous system, any dysfunction of the brain that occurs suddenly and is severe should be a prompting someone to think about a stroke, either a family member or the patient. But the common ones are weakness on one side of the body, typically face, arm, or the leg, or either of them, numbness or abnormal sensation that's sudden, speech difficulties, either understanding what's being said or having trouble saying words, sudden difficulty thinking, also difficulty seen from one eye or both of them, and then a few strokes that occur in the back of the brain sometimes can cause profound dizziness, difficulty walking, imbalance, and again, when that comes suddenly, that should be a sign of stroke. Those are the main ones.
Okay. Next question would be, what are the risk factors for a stroke, and can you prevent a stroke?
Right, that's an excellent question, and I think, that's really the target. We like to prevent strokes. We like to treat strokes, obviously, but the most effective, approach is preventing them. And to prevent a stroke, we have to know what leads someone to have them, what increases their risk. And so we talk about risk factors for a stroke. They tend to be very similar to those for heart attack as well. So controlling those prevents stroke, prevents heart attack. The most important one for a stroke is high blood pressure. So untreated high blood pressure results in high pressure within the blood vessels that can lead to weakening or sometimes expansion of the blood vessel, making them thick. And both of those situations can result in either ischemic or a hemorrhagic stroke. So controlling blood pressure is extremely important. Another important category is heart disease. So for heart disease, we think of two big areas. One of them are illnesses related to the rhythm of the heart. So irregular heart rhythm, there is one that's the most common and most dangerous. It's called atrial fibrillation, where the heart doesn't beat regularly. And that irregular beating of the heart can lead to clot formation inside the heart. And those clots can travel up to the blood vessels in the brain and cause a blockage and a stroke. Then other type of heart disease are structural problems, like anatomical problems in the heart. An important one is valvular disease, where there is a defect on the valves of the heart that can also increase the risk of clots forming within the heart. Other important risk factors include diabetes when untreated or not optimally treated. Smoking can increase the risk, almost double the risk of stroke. And then another important...
It's an excellent reason to quit smoking if you smoke.
Absolutely, absolutely. It does increase the risk of stroke tremendously. High cholesterol, untreated high cholesterol is another powerful risk factor. When a person has high cholesterol, that can result in buildup of plaque within the blood vessels, the lining of the blood vessels. That can decrease the blood flow, and many times that can result in a stroke. Sometimes the plaque that builds within the blood vessel can break off, and those pieces can go up to the brain and block an artery. Other ones include lack of exercise or obesity. And then finally, excessive alcohol consumption. There are other factors that are uncontrollable, that they inform us of the susceptibility or the risk of someone having a stroke that are important to know, but unfortunately we can't change those. That includes age. After 50, we know that the risk of stroke increases exponentially. Having a history of a stroke or having family history of stroke also increases the risk of stroke for someone. And then race and ethnicity, we know here in the U.S. is a factor as well. We know that persons of African American ancestry or Hispanic ancestry have an increased risk of stroke compared to other groups. So those are the main ones that we target decreasing.
Well, this is excellent information, and we thank you for sharing all that with us.
Absolutely.
Before we go any further, we do want to share the story of a very good story, actually, of one of your patients. This is Edna Solis's story.
It was like paralyzed. I was like, well, what's wrong? What's wrong with my body? This has never happened before.
What happened to Edna is actually a very typical type of stroke. She developed weakness in half of her body. She had a blockage of one of the blood vessels that goes to the brain.
My husband was in the bedroom and he comes out and says, what's wrong? I go, I don't know. I just can't walk. I can't move my right leg. I can't move it. I just wanted to go to my bedroom and go to bed. He called Dr. Sharma, and Dr. Sharma told him, Jesse, your wife is having a stroke. You better call 911.
Time is the most important thing for stroke treatment. Every single second counts. The longer that we wait, the more possibility for brain cells to die. There's evidence that if you come by ambulance, you're more likely to get treatment, and the treatment is going to be faster. We are a certified primary stroke center. We have 2 specialized units. One is a stroke unit, in which most of our patients go. We have specialized nurses that look for specific signs of stroke or stroke recovery. We also have an intensive care unit that is dedicated for patients who are more ill and require more specialized care. Edna did extremely well because she arrived on time to the hospital. We were actually able to give her a medication that helps to break the clot so that blood can go to the brain.
Like in 10 minutes after that, my toes started moving and my mind was okay, my speech was okay.
By the time that she left the hospital, she was actually walking and moving completely back to normal.
Salinas Valley Memorial Hospital is really good. Thanks to them, I'm okay.
Well, we would like to thank Mrs. Edna Solis for sharing her story with us. And I do want to take a moment to ask you, our viewers, if you have any questions for Dr. Colorado specifically about strokes, treatments, please send them our way. We will dedicate some time towards the end of this presentation to answering those questions. There is an acronym that helps identify the most common stroke symptoms. Can you please tell us what that acronym is and what are those symptoms? Because everybody really should know what these symptoms are.
Right. This acronym actually has made a tremendous change in learning about the symptoms of stroke. And stroke is a disease that we really need the help of the community to identify it, because the patients many times don't know what a stroke is and how it manifests, and that can delay treatment. And we'll talk more about the importance of time, but the acronym is FAST and stands for face drooping, which is the F, A for arm weakness, S is speech difficulty or speech disturbances, and then T for time, emphasizing the importance of calling 911 as soon as possible. These are not the only symptoms, as we discussed earlier. There's some other ones, but these 3 capture a great majority of patients. And so identifying any of those symptoms and calling 911 is really the target for the help we need from the community to identify and treat stroke as soon as possible.
And if somebody's having a stroke, or you think that, let's say your father, mother, your grandfather is having a stroke and they maybe have a little bit of that facial drooping, is it noticeable enough for it to register as this could be a stroke?
So typically, when the patient's having a stroke, it's very rare to have isolated symptoms that are just the facial weakness or one particular. Most of the time, patients have other symptoms. So the typical scenario, for example, is someone is feeling some weakness, and then the family will notice that there is also some abnormality on the face. They don't look symmetric. They have a bit of weakness in the face. That's when it comes very important to remember the symptoms, because putting those together makes it very likely that the person is having a stroke. So that helps in identifying and then looking for help.
For help. And speaking of help, you do want to call 911 right away. You don't want to drive yourself to the hospital or have somebody drive you. You really want an ambulance to come there for you. So let's...
let me comment, if you don't mind, Claudia.
Of course.
That's an excellent point you're making, because we now know through research that if a patient arrives to the hospital in an ambulance with a stroke versus if they drive themselves, the outcomes are better when they come through an ambulance. And we know the reasons, because it's a more organized process. As we will talk about later, when a patient's coming via ambulance, we prepare, we're ready to take the patient and do the evaluation as compared to when someone presents by themselves. So it's extremely important to emphasize the 911 call.
And it's also probably very dangerous for you to drive yourself to the hospital under those conditions.
Absolutely, absolutely. Or, or a family member, they should call 911.
Right, they're nervous or stressed, just call 911. It's the best thing you can do. So this is happening. Somebody calls 911, they come for the patient. Now, can you walk us through that scenario? I mean, what's happening in the ambulance as they're driving to the hospital, and what is happening at the hospital in those 2 or 3 minutes?
Absolutely. So that's been an area that's been changing over the years, and it's a very exciting time for the stroke providers. In the past, you will present to the hospital, they will do the evaluation, you will be put in a room, and they will evaluate. Now, by the time EMS or emergency medical services arrive to your home and they evaluate the patient, they determine that there are symptoms of stroke, they communicate directly with us so that we start preparing. When you're going in the ambulance, we're communicating with the ambulance, preparing, mobilizing what we're going to be using in terms of resources so they can clear, for example, the CT scanner. An emergency doctor goes to the door, meets you at the entrance, obviously if they're available, but the whole team gets organized. It's a team of doctors, nurses, and so when the patient arrives to the emergency room, they get treated directly by the stroke team. They get taken directly to the CAT scanner. We do a CT scan if the patient is medically stable. We are able to determine whether it's a bleeding type or the ischemic stroke, and that when the patient goes back to the emergency room, we can give the appropriate treatment, whether it be lowering the blood pressure if it's a bleeding type of stroke, or providing a medication that can help break the clot. In many cases, the patients may require surgery, so we consult a neurosurgeon who gets involved. Sometimes the patients may develop severe respiratory distress and they need to be intubated. So that allows us to prepare and be ready to take care of the patient even before they arrive. So really the care of the stroke patient now begins before they even arrive to the hospital. And that's why it's important to call 911 and come to an ambulance.
It's fascinating. Sometimes when I've been in the hospital and we do hear that overhead page, stroke, code stroke, I mean, this is what starts to happen, right? All that personnel rushing to the emergency department,
right,
and just waiting and getting ready for that patient to come through.
Right, absolutely. Pharmacy gets notified so they can prepare any medications that are needed so that they're vigilant on what the orders will be. CAT scanner becomes available. So it's a process that has been changing over the many years, and thankfully, we're optimizing definitely that. As we will talk more later, right, the technology, the ability to treat stroke has really, really expanded. But one of the missing pieces is more recognition in the community of when someone is having a stroke and arriving to the hospital on time.
It's very important. So every second matters, every minute matters. You need to get to the emergency room as soon as possible, dial 911. And you can essentially stop a stroke. I mean, is that correct?
That we can do. Unfortunately, it's not the typical scenario in the great majority of patients because timing many times is not ideal. But if patients arrive to the hospital, we can provide medications that can, if it's a ischemic stroke, which is the main one, we can provide a medication that can help break a clot. We have great outcomes, such as the one of Aetna, which we showed earlier. If the stroke is not interrupted or treated, optimally, we can prevent also complications from stroke, and that's a very important aspect of stroke care. So many patients that have a stroke can continue to have more strokes if they don't get treated appropriately. They can have complications that can result in worse outcomes. For example, patients can develop heart failure or can also have rhythm problems. Some patients can develop infections. Some patients may need respiratory support. So it's a host of multiple things that get done for a stroke patient, not only treating the stroke itself, but optimizing their recovery from the very beginning.
Okay. Earlier, you talked a little bit about the medication. So you get to the hospital as soon as possible and you're given medication depending
Right.
on the stroke that you're having. Can you elaborate? I mean, what are these medications? How are they given?
Right. So one of the most important ones, which is to treat the ischemic stroke, which is the majority and occurs when there is a clot that blocks an artery. There is a medication called TPA. This is a very powerful medication that can help break a clot. The limitation is that we can only give it within certain window of time, and that's the importance. The medication, if the patient qualifies, gets administered as soon as we know that it's a ischemic stroke. Unfortunately, too commonly we can't give it because it's been too long. When it's a hemorrhagic stroke or the bleeding type, the typical treatment will be controlling their blood pressure, making sure that the blood pressure is ideal, and then trying to prevent that the bleeding or the size of the bleeding stroke expands. And sometimes they may need even a surgery to relieve some of the pressure. Now we have had breakthroughs, and some people compare the discovery of this new type of treatment, mechanical thrombectomy. They compare it to penicillin to infections and how drastic it has been in treating a particular type of stroke, the bigger type of stroke. So when there is a big blockage of a large blood vessel in the brain, TPA is not sufficient to break the clot. So within the last few years, we've discovered that removing the clot mechanically with a catheter that's inserted in the groin, similar to a catheter for heart attacks, the catheter can be introduced and is taken all the way to the blood vessel, and the clot is removed. It's a minority of cases, but it tends to occur for the patients who have the most severe strokes. And so just like for the medications, time is extremely important for this type of treatment. It was initially used from 0 to 6 hours, but now it's been expanded and can be used in the right patients anywhere from 0 to 24 hours.
It's fascinating.
Yeah.
But again, time is of the essence.
Absolutely.
You need to get there as soon as possible if you're experiencing a stroke. Can a person fully recover after they have a stroke?
So the recovery for stroke varies significantly, and a lot has to do with where the stroke occurred and the size of the stroke. So many patients may have a medium stroke that occurs in an area that doesn't cause too much disability, and there may be patients who have a small stroke that occurs in an area that's very important. For example, the spinal cord or the brainstem that controls. It's the most important part of the brain. So a lot of the recovery has to do with the size and with the location of the stroke. But certainly we have patients with great recovery even if they had a stroke. So the care for stroke patients go beyond just that immediate, acute care, but goes thereafter. And for this patient, the most important thing is preventing another stroke. That's really where the big emphasis becomes once they have been stabilized, particularly if they have a full recovery, which is possible.
Okay. Another question here that I think is very interesting, because I think a lot of people tend to think, well, it's only older people that suffer
Right.
strokes, but it can happen to anybody, correct?
Absolutely. Stroke can occur even in children, which is rare. As we were discussing earlier, typically at age 50 is where the incidence starts to become exponential, but increasing research is showing that young adults are having increasing incidence of stroke, particularly between 18 and 50. And the thought and the research shows that it's because the vascular risk factors that we were discussing earlier, high blood pressure, high cholesterol, diabetes, obesity, they are starting to be more common in younger individuals. And also, the technology has allowed us to diagnose stroke more accurately than before. imaging techniques like MRI have really made a big change so that we can identify even small strokes that in the past, they will think, oh, the patient didn't have a stroke, but indeed now we know that many patients have very mild symptoms and they have suffered strokes. So the combination of those two has resulted in the increased incidence of young adults having stroke.
You mentioned something that was really interesting, and that was diabetes, and the fact that we have a lot of children being diagnosed with type 2 diabetes. So when they're in their early 30s, they've probably had this disease for 20 years or so. So now they're becoming, they're going to see a cardiologist because they're having heart issues, and now they may be in danger of having a stroke. So that's really, really sad. But at the same time, it's good to know this information and just know what you're...
Right, absolutely. It's an opportunity to gain more understanding of the complications that can come from diseases like diabetes and the importance of treating them aggressively from very early on. I think also it emphasizes the importance of having primary care, making sure that patients that are at high risk for different conditions like diabetes, cholesterol, high blood pressure, especially when it runs in the family, that they have regular checkups so that we can pick up these diseases and be aggressive about treating them so that major complications like stroke can be prevented.
And that person can have a better quality of life.
Absolutely, and
forward.
avoid this,
Yeah, you don't want to
horrible
have
disease.
this. No. Well, I do want to dedicate some time to answering some questions here from our viewers on Facebook, so thank you very much for sending those our way, and keep them coming. We can definitely spend a little more time answering some of these questions. Can a fetus suffer a stroke?
That's an interesting question, and like we were discussing earlier, indeed, children and even a fetus can suffer stroke. That is related, we know, because of the concentration of their blood cells, red blood cells, is higher. The time that's the highest risk is around birth, so we call that perinatal stroke. The highest risk is typically in the first few weeks, and many times is related to trauma during the delivery, sometimes dehydration or infection. Thankfully, the brain in children and babies, it's very plastic, so they can adapt much better than adults. So they can recover well in general.
Okay, but it must be terrifying for those parents to
Absolutely.
Have to go through that. Annette here says, my mom is 86 and had several I can't say that word.
Hemorrhagic strokes,
That.
yes.
She can't sleep now and is very agitated at bedtime. What are your recommendations, or what do you recommend?
Right, so that can be a common complication of stroke. I'm glad that she brought it up. Most of the time we focus on the direct complications of stroke, meaning weakness or difficulty talking, but unfortunately many patients with stroke can have other complications down the road. We now know that many patients develop depression, they can develop insomnia, they can develop problems with sleep in general. So in cases like this, the important thing is making sure that there is no underlying sleep problems such as obstructive sleep apnea, which can increase the risk of more strokes. And then if that's the case and there is no other primary sleep problem, a good routine, good hygiene of sleep, getting up at the same time, going to bed at the same time can be the most helpful. But many times it's necessary to see a sleep specialist for this.
And we definitely do have sleep specialists
Absolutely.
at Salinas Valley Memorial.
We have an amazing sleep center with great sleep specialists.
And they would require, so you would sign off on that and send them to our sleep center.
Typically is a referral to our sleep center, and they conduct sleep studies to make sure that the patient doesn't have underlying major sleep disorders such as obstructive sleep apnea or other sleep disorders.
Okay, thank you for that. Susie here says, if someone keeps smoking after a stroke, can they take medication to stop the craving? It's sad, such an addicting drug. Absolutely.
Thanks for the question, Susie. It's such an important question, and it is it is a very difficult disease. Tobacco is a very addictive substance. We know we have multiple treatments that can help with the cravings, and thankfully the cravings, the physiological cravings for smoking, the body really becoming unstable and asking for it, don't last very long. But definitely treatment can help, and we have multiple medications nowadays that, it used to be in the past that we only had nicotine patches or gum, but now we have other treatments.
That's
so
good to know.
Definitely there are options.
Good, that's good to know. Olivia here says, was rushed by ambulance with left side paralysis and slurred speech. When I arrived, my symptoms recovered. ER was not sure if it was a stroke. After several tests, was admitted and diagnosed with TIA. Can you explain this?
Yeah, absolutely. That's a great question, and we touched on that a little bit at the beginning. I'm glad that we're talking about it again because it's such an important entity. So when someone has a TIA, a blockage of a blood vessel to the brain occurs, but it opens spontaneously. So we presume that the clot that developed spontaneously broke off and the blood vessel reopened, and so the patients recover completely. But certainly the care that comes after is the most important because those patients are at very high risk for stroke. So in that case, you will require to follow up with a neurologist, with a primary care doctor to make sure that all of the prevention strategies are optimized, making sure cholesterol is well controlled, any diabetes, any high blood pressure, and being on the right medications to prevent another one.
Okay, and then Kara here wants to know, how long do you have to administer the medication to help break the clot?
That's a very
Good
important question. So the medication TPA was initially approved for 3 hours, but studies and research have shown clearly that it can be given safely up to 4.5 hours since the onset of symptoms. So right now we base it on the onset of symptoms that the patients or family report. We have undergoing research trying to use imaging to guide us also, because as you imagine, if you went to bed and you woke up with the symptoms, it's impossible to know when they started. We call those wake-up strokes, but there is ongoing research using imaging modalities to tell us this stroke is just starting or it's already been there. The issue with giving the medication later than that is that the risk of complications such as bleeding increases significantly. So it's very limited time window, 4.5 hours.
Okay. Orlando here asks, can someone pass away from a stroke?
Yes, Orlando, great. Thank you for the question. That's a very important question, and indeed they can. So unfortunately, sometimes patients decide to not seek medical attention even though they know or family thinks that they're having a stroke, and the complications that can come afterwards are very serious. So many patients initially can have mild weakness, and that can quickly escalate, and sometimes it can affect areas of the brain that control breathing, so that can result in death. Sometimes patients are having a stroke because of another underlying reason, such as a heart failure, a heart attack, and then certain strokes can occur, the blockage or the bleeding can occur in sensitive areas such as the brainstem, which is right in the middle of the brain and controls the most basic functions of the brain, such as breathing, heart rhythm. And so if a stroke occurs in that area, some patients, unfortunately, sometimes can die from a stroke. The other major cause is severe bleeding, such as from an aneurysm. That can also, unfortunately, can be associated with high risk of death.
Okay. Olivia wants to know, are TIAs a warning for a bigger and stronger stroke?
So a TIA, it's certainly we call it a pre-stroke or a warning sign for another stroke. So certainly they are. Not necessarily bigger or smaller, but if someone has had a TIA, the risk of having a completed or a real stroke is much higher. So we treat those patients as we treat a regular stroke patient. So TIAs provide us the best window to really make a big difference, because those are the patients that were going to have a stroke, and now we know that they're very high risk for having one, so we can intervene and control the risk factors and identify why they were having a TIA and prevent a real stroke.
Okay, well, thank you for answering those questions. Just a couple of more here. Are the symptoms for a stroke different for men or women, or are they the same?
Yes, so there has been research on that topic, but from my understanding, really hasn't been anything major, so the symptoms continue to be the same for both men and women, and those are the ones we discussed earlier with the acronym FAST: face drooping, arm weakness, speech disturbances, or speech difficulty. Okay. And then, there's always involvement, there can always be involvement of the leg, but the arm and face are the ones that we emphasize.
Okay. I have another person here, Medardo, and I didn't complete the question, so I'm not sure exactly what they're asking, but why blood tests when you have a stroke? Maybe they're asking,
I think I know what he means. So, a lot of the testing that goes on is mainly imaging, trying to identify if there is a blockage in the blood vessel in the brain, taking a picture of the brain, a lot of heart tests, but we also do a lot of blood tests, blood work, to make sure if a patient doesn't have a problem with coagulation that makes them very likely to develop clots easily. Then we check for problems with cholesterol. If a patient is bleeding, we check that they don't have any conditions that make them susceptible to bleeding, such as having low counts of platelets, which make you prone to bleeding, or any other problems with the coagulation of the blood.
Okay. Is there a certain type of stroke that can end your life instantly?
Yes, unfortunately, like we were discussing earlier, those strokes that affect the brainstem. So there's one called a basilar occlusion, or blockage of the basilar artery, which is right at the base, that's why it's called basilar. It's right at the base of the brain, and it provides blood supply to the most important parts of the brain. And when a blockage of that blood vessel occurs, patients can die, unfortunately.
Okay.
Or major bleeding from an aneurysm, because of the some patients with aneurysmal bleeds can have massive bleeding within the brain, and so those patients unfortunately can die very quickly too.
Okay. I just have one final question here, and it's, can people fully recover from a stroke, or are there always some lingering side effects?
So patients can recover completely. Like we were discussing a little bit earlier, sometimes patients may have a small stroke that it's in an area that is not very eloquent, or doesn't control movement, or anything that shows a clear deficit. So in those cases, when it's small and it's in an area that is not as important as others, patients do have a full recovery. And those are the ones that are the best ones to prevent. I mean, any patient with stroke, prevention from other strokes is extremely important.
Okay, well, we thank you, Dr. Colorado, for answering those questions. Oh, we have one more. Would you be able to give the clot breaker if patient is taking daily baby aspirin? Thank you for that question. Yes, we do.
That's a great question. So when patients, there are certain contraindications or scenarios where we cannot give the medication to break the clot, the TPA. When patients are taking antiplatelets such as aspirin or Plavix, we can use it. When patients are taking potent anticoagulants, we don't use it. But there is a lot of research being done on that. There is a common old anticoagulant called warfarin, and with that one we don't, but there are newer anticoagulants, and there is a lot of research being done. We may be able to give TPA in those scenarios, but that's still under investigation.
Okay, we have another good question here. Says, my son had a TBI at age 15. He is now 17. I want to know if they recover well after so many years.
Yeah, unfortunately, the recovery from a traumatic brain injury, it's complex. The longer that the patient has been with the TBI, the less recovery we see. But since he's young, definitely, more recovery is expected. But certainly, the longer from the event, the less recovery. That's not only for TBI, traumatic brain injury, but also for stroke. For most of the injuries to the brain, the recovery tends to be biggest at the beginning. In most patients with stroke, the recovery, the biggest part of the recovery occurs in the first 3 months, and thereafter things start to plateau. Depending on deficits, there can still be recovery even years after, but we know that those first few months are the most crucial. So that's why it's important to do physical therapy, occupational therapy, speech therapy, to optimize that window of recovery where the brain is reorganizing and becoming plastic.
Okay. One more question here. Annette says, my mom is having uncontrollable movements in her legs after a hemorrhagic, I can't say that word, stroke that bother her a lot. Do you have any idea why? What can they do?
So there are multiple complications that can come after a stroke. When there is uncontrolled movements, sometimes we think of seizures. Patients can have seizures after developing stroke because that tissue in the brain becomes very irritable, and seizure certainly is one. Some patients may develop what we call spasticity or involuntary contractions of the muscles. So those are the main ones that I would think of in that scenario. But obviously, it would be great to have a neurological evaluation or a more detailed examination.
Well, these have been great questions. I think we've learned a lot, and thank you for answering them.
Oh, it's my pleasure. Great question.
Yeah, no, thank you again for sending those our way. Is there anything else, Dr. Colorado, that you would like to say about strokes or other things in general?
Yeah, I think I wanted to end with, the summary about prevention, because really that's ultimately the goal. We hate to see the patients come in with acute stroke, and we're happy to treat, but the most important thing is to prevent them. And for prevention, thankfully, by trying to prevent the stroke, we actually prevent other conditions such as a heart attack, dementia. We know that the main strategy is having a overall healthy lifestyle and reducing vascular risk factors. And specifically, that means maintaining a healthy diet that is low calorie, low fat. Cardiac diet is excellent. Regular exercise, maintaining a healthy weight, avoiding smoking and excessive alcohol use, and then controlling those 3 big important factors that we discussed: high cholesterol, diabetes, and high blood pressure. If we control them, the risk reduces significantly. And then, most importantly, having regular primary care. That is extremely important, because that's when we identify that a patient has these conditions. So having regular checkups, particularly if there is a family history of these diseases.
And we definitely don't want people to delay their medical care, and that's something that's been happening a lot during this pandemic.
Absolutely. Unfortunately, that's been, it's understandable. We're all afraid because of the pandemic, but thankfully, in medical facilities and in general, we know now much more than we did before about COVID and how to prevent it. So it's safe to go to clinics. It's safe to go to the hospital. It's important to not leave these important conditions untreated. Many patients, are not treating their high blood pressure. Many patients are not going to their follow-ups because they're afraid of the pandemic, which I understand it's a true fear we all have, but it is safe, and these are things that are important.
And what's earlier we were chatting, and you mentioned COVID and strokes. Do you want to elaborate a little bit about that?
Yeah, absolutely. We've learned that COVID, just like other viral infections, and in general, the infectious state, when someone has an infection, that can lead to increase of coagulability of the blood. So patients with COVID can develop clots in the lungs, they can develop clots in the brain, and we're seeing patients with stroke and COVID, and we know that COVID increases the risk of stroke. So trying to prevent it is of great importance, and specifically making sure that that people are getting vaccinated. We know the vaccine is safe. We know Side effects are extremely rare, so it's important.
It's very important. They are safe, they're effective, they're free. You can get
Right.
them now pretty much anywhere, whether
Right.
it's a grocery store, a pharmacy, a regular pharmacy, or at one of our clinics. So really, there is no excuse. They are available. And as you all know, the Pfizer vaccine is now FDA approved, fully FDA
Right.
approved. So, and it is also available for kids 12 and older. So I do want to share that information with you all. Thank you, Dr. Colorado, for your time and your expertise. We really do appreciate you being here. Great questions. Thank you so much for answering all those for us. Next month, we'll be focusing on obesity. Our expert on that subject will be Dr. Joanna Oppenheim from SVMC Prime Care Salinas. That presentation takes place on Wednesday, September 22nd at 6:30 p.m. right here on Salinas Valley Memorial Healthcare System's Facebook page. For more information on that event and other health information regarding COVID vaccines and other health topics, we invite you to visit and follow us on our social media sites, which are obviously Facebook, Twitter, Instagram, LinkedIn, and of course, we encourage you to visit our website, svmh.com. Dr. Colorado, again, thank you so much for being here today. We really appreciate your time and your expertise and great advice. Best advice you can give would be get the shot, get the vaccine.
Oh, definitely. Right now, getting the vaccine is the most important. And then the regular primary care, that's of most important. Thank you for having me. It was a great pleasure talking about that. Thank you for the great questions that the audience asked.
Yeah, and then also remember that acronym, which is FAST, right? So
Face drooping, arm weakness, speech disturbances, and then finally time.
call 911. Okay, well, thank you so much, and thank you, and we'll see you next time. Take care.